I am Dr. Swatchla, Scientific Director with Zeba Fertility Centers. Tubal blockage could be one of the reasons of infertility. It could be caused due to a number of reasons. We'll look at some important ones. Any blockage at the distal end due to infection or a previous surgery could lead to hydrosalpinx. It is where water is accumulated. Over a period of time, it becomes toxic, and when it drips down into the uterus, it could cause implantation failure. That is when an embryo comes there, fertilization doesn't happen. Hydrosalpinx could be caused due to any infection, previous surgery, endometriosis, etc. This is one of the reasons of a tubal blockage. Then we should talk about endometriosis. When endometriosis is one of the reasons of infertility, it could be present anywhere, in the cervix, in the endometrium, in the ovaries, in the tubes. When present in the tubes, it causes tubal blockage, and in such conditions also pregnancy could be difficult. Sexually transmitted diseases such as chlamydia, gonorrhea, syphilis could also cause tubal damages. They could lead to scars, adhesions, sticking of these ovaries that could lead to infertility. Tuberculosis also could be one of the reasons of infertility that could be present inside the tube, which could be causing infertility. So how do we diagnose this? How do we know that your tubes are blocked? If you have tubal blockage, you will never get to know just by having irregular periods and all, because there are no symptoms to it unless there is chronic infection, there is endometriosis, and during periods you have very painful cycles. So the best methods to diagnose if your tubes are blocked are Hydrosalpingogram. This is a good procedure where dye is passed into the uterus, and if it spills from both sides, your tubes are open, or if it's blocked, we can assess it. Then there is saline sonography also, where saline water is passed into the uterus, and if it spills from both sides, then your tubes are open. Laparoscopy is a gold standard procedure where camera is passed through some ports from your abdomen, and your tubes can be observed to see if they are blocked or open. This is a very good procedure where if they are blocked, they can be opened as well. Not always is laparoscopy performed. We could begin with an HSG, a salpingogram test, Hydrosalpingogram, and after that, when we confirm a tubal blockage, laparoscopy can be attempted. Once it is diagnosed and this test is performed, if tubal blockage is removed through laparoscopy, you could try for 3 to 4 months for a natural conception, and if it doesn't, you could move on to other procedures such as IUI, intrauterine insemination, or IVF. So tubal blockage, when not solved, then it's better to go for IVF directly, because when laparoscopy also cannot help you, then IVF is the best form of treatment for such cases. If you wish to understand more, please feel free to contact us. Thank you.